Have you ever gone out for what should be a relaxing walk, only to find yourself suddenly slowed down by aching, burning, or cramping in your legs? You're not alone. For many older adults, leg pain after walking isn't just a minor inconvenience. It can be your body's way of signaling something important about your health. Today, we're going to take a deep look at why leg pain happens, what it can reveal about your circulation, muscles, joints, and nerves, and what simple, natural steps you can take to keep moving without discomfort. Let's start by understanding one key fact. As we age, our bodies become more vulnerable to wear and tear. Our blood vessels stiffen, our joints lose cushioning, and our muscles may weaken. That's why walking, a simple, everyday activity, can sometimes bring pain. But here's the good news. Identifying the cause of that pain can often lead to solutions that make walking easier, safer, and even more enjoyable. So, what are the most common reasons behind leg pain after walking? Let's break them down one by one. The first major cause is poor circulation, particularly something called peripheral artery disease, or PAD. Imagine the arteries in your legs as pipes carrying fresh, oxygen-rich blood. Over time, cholesterol and plaque can build up inside those pipes, narrowing the space. When you start walking, your muscles demand more oxygen. But if the arteries are clogged, your legs don't get enough blood. The result? Cramping or aching, usually in the calves. This pain often gets better with rest, but returns as soon as you start walking again. Doctors even call it intermittent claudication, and it's a classic red flag for circulation issues. Left unchecked, PAD can increase the risk of heart attack or stroke, so it's not something to ignore. Now, circulation isn't the only culprit. Another common reason is nerve compression in the lower back or legs. Conditions like spinal stenosis can squeeze the nerves that travel down to your legs. When this happens, walking may trigger pain, numbness, or tingling that eases when you sit down or lean forward. Some people describe it as a heaviness in their thighs or calves, almost like their legs are giving out. If you've ever felt that kind of strange nerve-like discomfort, it's your spine and nerves talking to you. Third on the list is joint problems, particularly arthritis. As cartilage wears away in the knees, hips, or ankles, bones can rub against each other, creating stiffness and soreness. For seniors, arthritis-related leg pain can make every step feel like a challenge. But the silver lining is that movement, done safely, often helps lubricate the joints and reduce stiffness. We also have to talk about muscle fatigue and weakness. With age, we naturally lose muscle mass, a process called sarcopenia. If you haven't been doing regular strength training, your leg muscles may not be as strong as they once were. Walking, especially uphill or for long distances, can quickly tire them out, leading to aching or heaviness. Think of it this way. Your muscles are like the engine of your body. If the engine isn't tuned up, it can't carry you very far without sputtering. Then there are vein-related problems, such as chronic venous insufficiency or varicose veins. If your veins struggle to push blood back up to the heart, it can pool in the legs, causing swelling, aching, or even a burning sensation. People with venous issues often notice their legs feel heavy or uncomfortable after walking or standing for a while, but better after elevating their feet. Of course, not all leg pain is related to disease. Sometimes it's as simple as overuse, dehydration, or electrolyte imbalance. For example, if you've been walking in hot weather and haven't replaced fluids or minerals like potassium and magnesium, your muscles can cramp. That sudden Charlie horse in the middle of a walk might be your body's way of asking for water or a banana.
Now, here's the empowering part. Many of these problems can be managed, improved, or even prevented with simple lifestyle changes. If poor circulation is the issue, Studies show that regular, structured walking programs can actually improve blood flow over time. Think of it as training your arteries. Start with short walks, rest when pain kicks in, then continue once it eases. Over weeks and months, your body adapts by creating new pathways for blood to reach your muscles. Pair this with a heart-healthy diet, low in processed foods, high in fruits, vegetables, whole grains, and omega-3 fats, and you're giving your arteries the best chance to stay open and flexible. If nerve pain is the cause, gentle stretching, physical therapy, and core strengthening can reduce pressure on the spine. Some people even find relief by leaning slightly forward on a walker or stationary bike, which opens up the spinal canal. For arthritis, low-impact exercises like swimming, cycling, or Tai Chi keep joints mobile without pounding them. Weight management also plays a huge role. Even losing 10 pounds can take 30 pounds of pressure off your knees with every step. Imagine the relief that brings after just a short walk. For muscle weakness, the solution is clear: strength training. Research shows that seniors who lift light weights or use resistance bands a few times a week can rebuild muscle mass, improve balance, and reduce fatigue. Stronger muscles act like shock absorbers for your joints and take the load off your circulation system. If veins are your concern, simple steps like wearing compression stockings, elevating your legs, and staying active can make a big difference. Avoid sitting or standing for too long without moving. Your veins thrive on motion. And let's not forget hydration and nutrition. Drinking enough water, eating potassium-rich foods like bananas and sweet potatoes, and including magnesium from leafy greens or nuts helps prevent painful cramps. Your muscles are electrical tissues. They need these minerals to fire properly. So, what does all of this mean for you? Leg pain after walking is not something to brush off. It's your body's feedback system. Sometimes the cause is harmless and temporary, but other times it's a sign of deeper issues with circulation, nerves, joints, or veins. Paying attention now can prevent bigger problems down the road. If you notice recurring pain, especially pain that stops you in your tracks, don't wait. Bring it up with your doctor. Simple tests like an ankle brachial index, which compares blood pressure in your arms and legs, can quickly identify circulation problems. Imaging scans can uncover nerve or joint issues. And with the right diagnosis, you can take steps that restore comfort and mobility. Remember this: walking should be one of the most enjoyable and health-boosting activities for seniors. It keeps your heart strong, your mood lifted, and your independence intact. Don't let leg pain steal that from you. By listening to your body, staying active, and making a few smart changes, you can keep walking with confidence for years to come. And as we wrap up, let me leave you with this. The journey to healthy aging isn't about ignoring pain. It's about understanding it. The more you know about your body, the better choices you can make. In the next video, we'll explore another powerful way to protect your long-term health and keep you feeling your best.